When a child's cancer treatment is not going well, knowing what to say can be daunting. However, as clinicians, we need to be sensitive to the parents' and the children's emotions, while also managing their expectations appropriately. Our team has spoken with many experienced health professionals who work with young people with hard-to-treat cancers. They told us that they valued hearing how other clinicians approach these situations. In this video, we will share strategies that clinicians told us help them to foster compassionate communication. There may be some new ideas in this video that you can use in your own practice. There are times where a patient's family are distressed and not in the right headspace to take in complex medical information. One clinician told us that they found it especially helpful to become a familiar touchstone for the family. Spending time with the family and patiently explaining and re-explaining information in detail as needed displays compassion and competence, which builds trust and reassurance.
I've always spent a fair amount of time with the family early in diagnosis. Even though the patient and the family may not remember all the things I tell them, they feel as though we've done this before. It's our bread and butter, and that gives them reassurance.
We understand that healthcare professionals have a busy clinical load, but taking the time to prioritise planning can be beneficial for both you and the family.
I plan in advance, so I know what I'm going to say. I've read the literature, and I have that information sometimes printed out for the family.
This can include diagrams tailored to the family's needs or information being distilled into a few words.
I sometimes write down keywords, even if it's just on a piece of paper with 5 or 6 words. Nothing overwhelming, it just gets some key points across to the family.
Hard-to-treat cancers can involve testing, which takes a lot of time. Naturally, families are anxious to find out the results. Often there is nothing to report in the interim. When there are no updates to give, you as a clinician might feel that nothing yet may be an inadequate response to give family members who are distressed. In these situations, detailing the processes involved in the tests and communicating any issues that have been faced in testing can be comforting for the family.
There had been a huge amount happening behind the scenes. Some things hadn't quite worked out, and they had to redo some of the experimental conditions and run it again. As soon as I explained this, the family then went, right, okay, they really are trying hard to get information for us. It didn't change that there was no information yet, but I think it was good for them to see behind the scenes.
Ultimately, if you feel unsure about how well you are handling these conversations, you can always seek help from your peers.
You've got the medical team, the nurses, you've got social workers and other people. When communication with the family feels difficult, that is when the feedback from your colleagues could be really helpful.
Others' perspectives can serve as helpful advice.
Knowing what doesn't work with a particular family or other particular things that are going on with that family would allow you to communicate better. So being open to feedback from your colleagues is absolutely critical.
It's not always possible to fix everything, and that's okay. But by prioritising empathy and patient-centred care, taking enough time, preparing well, and above all, reflecting on your approach, you can reduce the stress that families experience. By being mindful that we deliver information with compassion and sensitivity, every word we speak can have a lasting positive impact.